feel very passionate about it. It's going to offer you some significant savings. We did a focus group with some of your peers, and they gave it the 2 thumbs up. So we think you'll like it as well. So pay attention. And I'll jump up and talk after Ryan. But this is Ryan. He's with Renewal. They're our consultants, and they've helped us really, really shore up a good plan this year. So excited.
Awesome. Thanks, Paige. Like Paige said, my name's Ryan. My company's Renewal. I'll point it out here in a second, but we've got a page in the benefit guide on how to contact us. So if I'll be here after if you want to stick around and ask me questions, but if you need help throughout the year with something like a big claim or just anything related to your benefits, you're welcome to talk to Paige or Emily, but you can also reach out to us directly, and I'll point out our contact information here shortly. But like Paige said, we kind of help you guys pick out your benefit plans every year and help design them. And so I'll walk you guys through the options for this year, and we'll be using the benefit guide. If you want to turn to page 4, just for those of you that are new, do we have any brand new team members in here?
I don't think so in here. Not okay.
So I'll give more of an overview of medical, or a longer overview, the dental, vision, and then your base life through your hospital indemnity plans. None of those are changing in terms of price or coverage, but your life insurance and disability are updating to Guardian. If you're already enrolled, you can stay enrolled from One America to Guardian. So that's no big deal. We'll talk about that in a minute. But your medical insurance is still through Allied, and the network is Cigna, PPM. And we'll talk about those options. So we'll go ahead and flip over to page 8 and 9. So page 8 is your UKG kind of how-to. I think most of you guys probably log in pretty frequently to UKG, but if not, obviously that's where you're going to do your open enrollment in terms of your actual elections. You've got until the 11th, but if you enroll by this Friday, you'll be entered to win a gift card via Paige and Emily, which is pretty cool. And I'll let you guys show the chat thing and everything afterwards since you've been on the screen. But the next page is our member services. So that's my company, Renewal. Again, if you're not the primary person that picks out benefits in your household, feel free to have whoever that is book an appointment with us. We can walk them through it prior to the 11th, help them pick whatever plan is right for you and for your family, respectively. So that's us. And then if you'll flip to page 10, we'll spend a lot of our time going through these medical plans. So again, this is open enrollment. If I forgot to mention this in the beginning, if you want to add a dependent, add a spouse, take them away, change plans, enroll for the first time, those are all things you can do now. So it's open enrollment. All these benefits, new benefits, will start January 1st. Your deductible, just like always, or your dental plan, everything restarts Jan 1, right? So everything you do today will be for that new year. Hard to believe that we are almost upon it. So let's go over these medical options, and just interrupt me with any questions you got along the way. There's no bad question. Just shout it out and ask it. So option 1, this will be, if you've been here a while, will be like a plan that you've had for a long time. So there's 2 options. Option 1 is an HSA compatible plan. And so what that means is everything that you do is contributes towards your deductible, which is $5,000. So the deductible and out-of-pockets are actually the same on both plans. But with option 1, you're going to pay the full cost of all your care up to that deductible. Okay, so there's no upfront covered services. There are a few things that you don't have to pay your deductible for on option 1. One is text care, so you'll still have that. You have it now. If you haven't used it, it's really like a great urgent care replacement virtually, right? And you can text in, you can call, you can FaceTime with the doctor that's assigned to Gold Bond from TextCare. It's a great company. So that you would have if you're on option 1. You'd also have a preventive RX card and your preventive visits, like your well checkup once a year. So those things would be covered up front on option 1. But let's say you needed to go see an orthopedic surgeon because you're having, some back issues, etc. You would have to pay the full cost of that visit on option 1. Okay, there's no copay for that. But let's say that you had an inpatient hospital stay and you were there for a few days and it was very expensive, maybe it was a $15,000 bill, you would be responsible for 5. So that's how this insurance plan works. You pay 5 as long as you're in network the rest of the year, the rest of your bills will be covered, right? So you've got kind of a maximum protection there that you would pay. If you have a family on the plan, only 2 or more people have to combine to hit 10,000 to satisfy the family deductible. And because the deductible and out of pocket are the same, you almost could just scratch off the out of pocket line or deductible. They're one and the same. You don't have to keep track of both. It's just 5,000 and 10,000. So that's all the numbers that you got to remember there. So again, on option 1, it does qualify you to both open and contribute toward a health savings account, which is just a bank account that you can use for health, dental, and vision expenses, right? So if you're on option 1 now and you want to switch to option 2, you can. You certainly don't have to, but if you did, you could keep your HSA. You just can't put any more money in it once you move off this plan, right? So in order to contribute, you've got to be on a compatible insurance plan option, and that's what option 1 is, okay? So you can see these are weekly payroll deductions down at the bottom, and they're the same for options 1 and 2. So really, it's kind of just going to be a preferential choice. Like if you love being on the HSA plan because you want to put money in the HSA, that's totally fine. You can do that. Or you can enroll in option 2 and it's going to be the same cost for you per week either way. So option 2 is a plan that's going to be much different than probably maybe what anyone's ever experienced in here, but definitely than what Gold Bond has had. So on option 2, for your physician office visits, Gold Bond is actually going to pay for you to have a membership at Hitchcock Family Medicine. They're right up the road. They're in where the old Ryan's Steakhouse used to be, which is behind the coffee. It's
Dutch Bros.
Dutch Bros. Thank you. Right off of Hickson Pike. So it's a couple miles from here at the most. So real close to the mall. They used to have a couple different locations, and now I think they've consolidated into one bigger one. And as it just so happens, it's really close to your office, which is really nice. So with Hitchcock, they're what's called a direct primary care practice. And so what that means is they've got 5 practitioners or doctors that have all come from, they used to either be in a big private practice or they worked at Erlanger, or maybe they moved from out of state and worked at like HCA. And typical primary care physicians will have 3,000 to 4,000 patients, and it makes it really hard. And you guys have probably experienced this. I've told this story probably in every enrollment session, but with my kids, they're at Highland Pediatrics. We go in, it's like going through an assembly line. They weigh the kids. It's somebody you don't know. You get in, you talk to somebody else you don't know. By the time you see your doctor, they come in and talk to you for 10 minutes, flip a bunch of charts and tell you what you need to do, and then they're out there, right? Because they don't have time. They have all these other patients waiting in the office, and they've got to skip between rooms. So that's kind of your typical healthcare experience, right? And with Hitchcock, their establishment appointments are almost an hour long. So they want to really get to know you, get to know your health history, come up with a plan. But there's no catches with this. Gold Bond's prepaying the membership. So when you go, there's no cost for you to go to their clinic. Now, if you have an established primary care physician, you're like, hey, I've been seeing this person for 20 years. I'm just not going to move off of them. That's okay. You can still do that. You're just going to have to pay the cost of the visit, just like you would normally. But if you say, hey, I kind of want to give this a try and see if, Hitchcock's got a provider I like, and if they can help me kind of on my healthcare journey, et cetera. Again, you could go 20 times in next year, or you could go 2. You wouldn't pay for any of the visits. They will also offer something like a text care where you can get in touch with them during the middle of the night or like on a weekend or something like that, et cetera. But the whole reason that we're doing this and putting this in place is because I look at healthcare data all day long, and basically what the data says is even if people say they have a primary care doctor, they're not really engaged and they don't really go every year. Most people don't. Some people do, but a lot of people don't either have an established doctor or don't feel like their doctor has time to really talk to them, or maybe they're just not getting the results that they want for their health. So this is just a different model where you don't have to pay. You can get next day or a lot of times same day appointments because they have less patients. So direct primary care's model is they'll have 700 to 800 patients per doctor versus 3,000 or 4,000. It's a big difference, right? So they have time to actually spend with their patients and get to know them. If you have lab work done in their clinic, Gold Bond's going to cover the cost of it. They offer really nice pricing on those services. So Gold Bond will like to just pay for that if you have to have it. With, if you need to get like, basic blood panels, outside of even your preventive checkup, that will be covered. If you have to, they do have an X-ray and a CT machine there. If you need to get one of those done, it would be covered at 50%, and you just pay the other 50, but it's basically going to be paid on like a cash price type basis. So you're going to pay a really low rate, and it'll be disclosed. Like if you come, they'll actually be here tomorrow at 10. If you want to meet some of their team. But again, the other thing that they do is they have like a pretty long list of wholesale, like generic and brand medications that they'll dispense in-house at their clinic. So there'll be some stuff that they might not be able to fill for you. You can just run that through your normal insurance card. You'll have a copay. We'll talk about that in a second. But if they can, you can fill it there. You'll pay kind of a cash price and you can pick it up. But again, just to sum up, the visits don't cost you anything. You could go as much as you like, or once a year, just to kind of establish and check in. The whole point is for you guys to have a place where you can have primary care and feel like you've got somebody that's your actual advocate and is not incentivized to bill you every time you walk through the door, right? They're not trying to get you to buy more of their services. They're already being paid for the membership fee, right? They can do stuff. I'll call it emergency room prevention. Like they can do minor stitches or like even a cast, like if you broke your arm. So I wouldn't be afraid to utilize them as kind of your front end, especially since it's no cost. And see if they can help you. And if they can't, they might make a recommendation of, hey, if I were you, I'd go to this provider because it's going to be the best outcome, but you're going to spend the least amount of money there. If they referred you out to, let's say, a gastroenterologist or something, or an orthopedist, you would pay $75 to see a specialist on plan 2. Okay, so there is a copay for that. So if you already have an established specialist, you don't have to have a referral to go see that. It's not an HMO plan or anything like that. But I'd still say go establish with Hitchcock. Let them know, hey, I see this person for allergies, or I see, they'll get your health history just like a normal doctor would. Again, nobody's forcing you to go to them, but even if you already have an established primary care, I think it's still worth getting in with them, making an appointment. I always tell people in healthcare, it's really great to have a second opinion on stuff. Not all doctors are created equal. And that also might mean that you may pick a different doctor in their clinic than one of your coworkers because you don't, personality wise agree with it or what have you. So again, options are always good. I think though, this makes your healthcare plan really rich because a lot of your front end services that you would use on like a daily or monthly basis for healthcare should come at no cost to you. The other thing is let's say you go there, but you need an MRI. We are doing a direct contract with Prime Imaging. So you may have seen their clinics. They've got one on 153. They got one on Macaulay. They do like PET scan, CAT scan, MRI, X-ray, biopsy, ultrasound. They'll even do things like epidural injections. They do a lot of things that might not be necessarily like directly on their website. They're a client of mine. I know they're doctors. They're great people. They're good at what they do. They do a similar thing with their insurance plans as you. And so they've agreed to let our clients access them at on a discounted basis. So if you need imaging related things outside of Hitchcock, go there. You'll either have a copay and we'll release the schedule of what they do, what you'll pay. So it'll be very clear. And there might be some instructions on like saying, hey, I'm a Gold Bond employee. So they know, but you'll be able to go there and get discounted rates for imaging. So for example, like an MRI is going to be around $350, which again, if you went and just used your Cigna insurance right now, it would be a lot more expensive than that, even with the discount. You're probably looking at $600 plus for any kind of basic MRI at the least. So we're trying to make things to where you can really go have some affordable options for basic level stuff. Now, if you have to have knee surgery or something, where you're going to stay in the hospital multiple days, very little that we can do to have that be super discounted for you. You're probably going to hit your out-of-pocket costs is the unfortunate news there. However, on this plan or plan 1, it's the same. You're at $5,000, and you're going to be covered for the year. I would say, relating with Hitchcock too, because you don't pay when you talk to them, you can feel free to involve them in your actual healthcare decisions and get advice. You're not going to get charged every time you talk to them, right? So a huge perk there. We have a client that uses a plan like this. The first year, I think maybe 50% of them or so were engaged. They've been doing it now for 5 or 6 years. Their team loves it because it's become really their front end for all their healthcare stuff, and they don't feel like they're getting nickel and dimed every time they go to the doctor. all that to say, finishing out your plans here. So on plan 2, remember, you do have a specialist copay. If you have your kids on the plan, so I have 4 kids, they go to Highland Peds. If your spouse does not want to take them to a different pediatrician, or you don't, there's a $25 copay for kids under 19 to see their primary care doctor on this plan. So not trying to penalize anybody for not wanting to move their kids off the pediatrician. Other covered services on this plan, if you need to fill a prescription that Hitchcock cannot fill in their clinic, or if you just want to get it outside their clinic, that's totally fine. If you want to go to a pharmacy by your house, right? CVS, Walgreens. With SmithRx, you can go to any pharmacy, you fill anywhere you like. They do have great mail order options, by the way. If your prescription is eligible for it, I would highly recommend it. It doesn't cost you more, and a lot of times it might cost you less. And they'll just deliver it right to your door. But you have 5 tiers on your drug card. So tier 1 through 5. 1 is probably going to be mostly generic at $10 a month. And then tier 2 and 3, $45 a month, $90. The last tier, tier 5, you've got a deductible on that tier. So even if that's included in your medical out of pocket, but it's you'd have to pay it to access that tier before you hit the $250 copay. The only reason we're doing that is because with a lot of these tier 5 medications, there's a lot of alternatives that might be on tier 1 through 4. If there's not, it's not like you're going to be precluded from taking it, but you just have that deductible before that copay. If SmithRx reaches out to you, it's not spam. They're probably trying to see if you qualify for some of the money saving programs they have for you to be able to access medication for low or no cost. So especially some of the really high end drugs that maybe as seen on TVs is what I like to call them. A lot of those will have a patient assistance programs where you might qualify based on your income or household income to get the drug for free. And they'll actually help you with the paperwork. And then you just re-up it once a year. So if they call you, that'll be very few of you that have those phone calls, but might be somebody in this room. And if that's you, just answer the phone to them. We'll get a list, our team of people that have it, and we might reach out to you, and it might be like your pop-up blockers or spam on your phone, maybe blocking them. That way we'll tell you to reach out to them if they're calling you. So, but again, those are your 2 medical plan options. Just remember option 1, everything goes towards the deductible you pay out of pocket. Option 2, you kind of got a lot of upfront covered costs built into the plan, and free healthcare that you can access on that plan. So nothing wrong with staying option 1. If you're like, hey, I don't ever go to the doctor and I don't want to go, I want my HSA, that's totally fine. Nobody's forcing you to pick one over the other. But again, if you're going to plan on utilizing the healthcare plan at all, I would encourage you to think about option 2 because it's the same cost, right? So again, those are the weekly payroll deductions at the bottom. Does anybody have any questions? There's no bad questions on this stuff, so feel free to shout them out. Yes.
I think I had the Hitchcock for a while before I had insurance here.
Okay.
And, I was paying their payment once a month.
Yeah.
I wasn't using it very often, so I switched it over. Now, if I go back to them, they're going to charge me extra to get back with them, or will I not? It'll be through this.
Yeah, so you'll have coverage automatically. Gold Bond would be paying that fee on your behalf. So,
Okay.
and really, if we're going to encourage people, if they at least to go once a year, because Gold Bond's paying the fee, to just establish and have somebody that can be your advocate as their doctor will be. But yeah, they do give a little bit of a discounted rate, not a ton, but for companies, because they're kind of buying in bulk, if you want to think about it like that. But it's the same model. They pay a monthly fee so you can have access to healthcare for free.
I was paying the monthly fees, but I just wasn't using it as often.
Sure.
Maybe twice a year, and I paid all that money into them, and I didn't use it a whole lot. So I got out of it. But if Gold Bond's going to pay for that fee, I can probably get back in it.
Yeah, you'll be automatically eligible to enroll, and you just have to fill out a quick online form before you go, and you'll be off to the races. But yeah, you don't have to pay anything. You just pay your medical premium through Gold Bond, and that would you would be in. So, good question though. Yes.
If they Hitchcock sends you to a specialist and you pay the $75 copay, is everything that's done in their office at the specialist office covered
Mm-hmm.
after the copay?
Yeah, the only case where it wouldn't be would be like if I'm trying to think of an example. if you went to a specialist and they did some type of like scan or testing, that you would have to pay something additional for. But the way that we design the plan is, yes, in office covered services. So if you pay 75, it would cover that office visit, right? So yes, it should be covered when you go see a specialist, unless they send you out of the building to do something, is the general rule of thumb, right? So yes.
Quick question. So if we're paying like, I mean, let's say for just myself, if I'm paying $14 monthly or weekly and everything, where is that money going to? Is it going to like on our health? I don't know what that app is called, but we have an app from when we're paying on it, our money is going on there and we're able to use that money for like, if we needed to go like to CVS and like Walmart and get the basics. Where's that money? Is that going on the same thing or is it?
Yeah. So this is your premium. So this is actually you paying for your insurance plan is what this $14.54 a week is. What you're talking about is, let's say per month you were putting $20 in your HSA. That's completely separate. That's your money that goes in a bank account. So if you've been doing that, it's still there, hasn't gone anywhere. It's the good news. You just need to call Health Equity and either order yourself a new card or go online to see how much is in your account.
Okay.
Yeah. And that is on page, we'll get there in just a second, but it's on page 12. So that's Health Equity is what you're describing. So that's your HSA account. Yes.
So if we were to switch from the doctor that we have now to the Hitchcock, if you have prescriptions that had to have, like go through the approval process, do you have to re-go through that approval process if you switch doctors, or will your prescription kind of carry over?
No. So the PA is good for however long it's good for. So if it's
Because I
a
have
year,
an X amount of refills, you know,
yeah.
and I didn't know if I would have to get another like pre-approval process if I switch doctors.
No, you would just, whenever the next one comes around, Hitchcock's office would just do that one. So yeah, but
So it
you're
wouldn't
good.
necessarily affect current prescriptions and stuff.
No, because Smith RX has already got that PA from your current doctor. So
Okay.
no, you'd be fine.
All right. Thank you.
Yeah, you're welcome. What other questions? Yes, sir.
So I've been using the HSA program.
Uh-huh.
Looks like this year I'm going to switch over to this new program with Hitchcock. I like that. But any money that's currently on my HSA account, how much time will I have to utilize that money? Does that account get frozen, paid off, or anything? That money there until I spend it?
It's indefinite. Yeah, and you can even spend it on Medicare premiums when you retire. So I mean, it's like you can't go wrong with it. So don't feel in a rush. I would just say dental vision stuff comes up, or maintenance medications, whatever, you should use it on that. Yeah, but you're good. Good question. Anybody else? All good questions, actually. All right, if you think of any more, just stop me. I'll come back. The next page, they'll be here tomorrow, by the way, Hitchcock's. Do we know who's coming?
I don't.
Okay. Someone from their team will be here tomorrow to kind of answer questions and just kind of do a meet and greet at 10 a.m. in here. I think I'm actually going to stop by Tony for my team because I'd like to meet more. I've met the guy that owns it. I know he's a really nice guy, and his wife, but she's the office manager, but I haven't met the rest of the doctors on the team. But all that to say, I didn't even know this, but they're listing, they can even do casts for non-surgical broken bones. I guess if you broke something that you just need to get so anyway, I think they can do a lot of stuff that is, again, I call it emergency room prevention. So even if you're not hey, I don't need to go to the doctor a lot. Obviously you never know when you're going to need, to have something done in an emergency situation, but they are a 24/7 access to your doctor. Their clinic isn't open 24/7, but if you got in a pickle where you're like, hey, do I need to go to the emergency room or not? You can still use text care. That will still be there. But if you're kind of more established now with Hitchcock, you could just go to them and ask them to. I don't think there's a wrong answer there. So, so that's their informational page, and they'll have much more tomorrow, I'm sure, when they come. To your earlier question, so page 12, this is the Health Equity if you remain on option 1, or if you don't. If you have an HSA account, this is who it's through. It's your account. It's not a use it or lose it. So it's there as long as you don't spend it. It remains the same. Now, if you've got a large enough balance, I think it's like 2,000 plus or 1,500. There's some investment options through Health Equity. You can determine if that's right for you or not, but some pretty unique things. You can also spend it on other members of your household. It doesn't even have to be you or your dependents. But, if you remain on option one, these are the limits you can put in per year down at the bottom. And then just remember it's tax deferred. And the only way to keep the tax protections on the account is just you have to spend it on health, dental, or vision expenses or qualified medical expenses. So, long list of things. If you download the guide and click on this HSA guide, you can find that list of expenses in there if you're curious. Next page, your telemedicine or text care option. I'm sure some of you have used this year. You get this on either plan. Again, you should have gotten a welcome text at the beginning of the year. If you don't, you can just scan this QR code or save this number. This is the text care number. If you texted it and said, hey, I think I've got a sinus infection, they would text you back and say, hey, Ryan, great to hear from you. Like, let us help you with that. And you would kind of start your doctor's appointment that way, right? So super easy. You don't have to download any apps, anything like that. So I would say, at least from now through the end of the year, if you've got kind of urgent care related medical needs, I would highly encourage you to use this because it's free. The company pays for you to have it. So the next two pages are Smith RX. Again, they'll be on, if you've already got a medical card, they're probably somewhere down in the corner. Your VIN number, PCN, none of that stuff's changing. You might, if you're taking a maintenance med, maybe think about getting one refill before the end of the year, just to be safe. But you guys should be good to go, right on January 1. But I always just tell people it's the safest bet just to do a refill before the end of the year. That way you don't have to worry about, some sort of administrative holdup. You will get a new ID card from Allied because of the changes on plan option 2, but your Smith RX stuff will be the same. So you won't have to worry about redoing anything there. And in the case this young lady asked about the prior authorization, if you have a drug like that, it just really depends on the drug. Some of them are once a year. Some of them are once you get on it, they don't need another one. It just totally depends. But they are your pharmacy benefits manager. All right, so moving on. So dental and vision, or Blue Cross Blue Shield. They have a great dental and vision network, really hard to go out of network. You should have no issues finding an in-network dentist. Just as a reminder on how your dental plan works, you've got 2 cleanings per year at no charge, and then once a year x-ray. If you do have to get like a cavity filled or have something major like a root canal, God forbid, then you pay $50 and then you would pay the co-insurance. So either 20% or 50%. Blue Cross would pay 80 if it's like a minor dental thing. If it's a major dental thing, they're going to pay 50%. And then they'll pay up to $1,500 worth of coverage a year. So if you have to get something back to back done, I would recommend doing it now and then doing the rest in January because your out of pocket max will reset. You do have ortho coverage or orthodontics, for kids up to age 19. And that's $2,000 for the lifetime of their braces, meaning you can use that $2,000 benefit one time. I wish it was more because I have 4 kids and I would love for it to be once a year, but it is not. Then you can see your weekly payroll deductions down here at the bottom of that plan. On the back, on page 17, you got vision insurance, also with Blue Cross, $10 for your eye exam and then $40 for your contact lens fitting. And you've got an allowance that you can either use on frames or contacts, unless you have medically necessary contacts, and they would be free. Lenses, there's a copay for those. And again, with frames or contacts, it's every 12 months, there's a reset. So you could kind of do one year and one the next year if you wanted. And you can see the payroll deductions weekly down there for those as well. Life insurance, which is the next page, the company pays for you guys to have $15,000 worth of life insurance. Because we're switching to Guardian, if you flip to page 19, the next page, you can buy more life insurance on top of the base life. If you don't have any term life insurance, this is a great way to get it with no paperwork. This year, because it's a true open enrollment, you could get up to $150,000, no paperwork. You don't have to buy 150, you could buy 50. If you've got dependents, kids, and you don't have any life insurance, I would encourage you to just probably get at least a little bit. If you have pre-existing conditions, then I would also encourage you to take advantage this year of it being an open enrollment. So you can buy over 150, you just have to fill out the paperwork called evidence of insurability, and you either get approved or denied for it. And if you get denied, they just bump you back down to the 150,000 mark. So, but that's voluntary life. Again, no requirement to buy it. It is term insurance. So it's age-based. It's how the pricing works. And then when you log into UKG, if on disability or life insurance, it will price it based on your age. Disability will be based on age and income, and you'll be able to see before you click select how much you pay per pay period. There's two disability, short-term and long-term. Short-term covers after 12 or 8 days up to 12 weeks, and then long-term covers after 90 days up to 5 years. If you are thinking about getting pregnant, I would highly encourage you to buy short-term disability before that happens, because you can't once you are. And it would pay when you're on maternity leave for not the full 12 weeks, but for part of it, pay 50% of your salary for those weeks. I think it's 6 weeks up to 8 for maternity on that. And then long-term, obviously, it kicks in after day 91. So those are your two short-term and long-term disability options. The rest of your benefits are what are called indemnity plans, so kind of like a reimbursement or a payment based on the policy. So the first one's accident coverage. I have this because I've got kids that play sports. So if my son breaks his arm in flag football, I can claim every part of the doctor visit, the surgery, the PT, the x-rays, all of it. I would get checks in the mail from Guardian and cover that, which is nice. You've got two options, kind of a low-high plan. Option one is less on the reimbursements, and option two is more on the accident coverage. But again, it has to be as a result of an accident. That's what this plan is. Next to critical illness and hospital indemnity. Critical illness is you select a lump sum, 10,000 or 20,000 in the case that you get diagnosed with, like say, cancer or heart disease. There's a list of covered things, and they would mail you a check based on the diagnosis. And then lastly, hospital indemnity. Again, if you are thinking about having a baby, I would tell you this would be something that you should probably also enroll in, and then you could drop it post having said baby. But if you also think there's a possibility that you're going to have elective surgery, I would go ahead and buy this now, because you won't be able to buy it once that's scheduled, or you wouldn't qualify for it. But the hospital indemnity will reimburse you for a stay in the hospital. So pretty straightforward there, and you can see the amounts kind of per day for ICU versus regular hospital. If you have critical illness now or hospital indemnity, don't forget to turn in your wellness benefit. So that's if you've gone to your primary care this year. I think you can also turn in dental, like basic exams for dental, and you'll get a $50 check. So it'll at least cover part of your premium, which is great. And then last couple things here, and we'll finish up. You guys do have an employee assistance program through your benefits. It's no cost to you. If you need any of the covered things on this list, help with them. A couple things to point out, like top left, like anxiety, depression, stress. If you want to get in touch with a counselor for mental health related stuff, that's there. And then on the right hand side, they do have online will prep, which I think is great. So if you need a will done, you don't want to pay an attorney, it's a great way to get a basic one done, get that in place. So no cost to you on those programs. And then last but not least, if you turn to page 26, you guys do have a pet insurance option. That is a real thing, believe it or not. Pets are expensive. If you want to cover your puppy, I think they go all the way up to like older dogs, and I think they do cats too. You can call how to enroll down there at the bottom right. So this is you wouldn't do this through UKG, right? They have to do this direct. Yeah, got to do this direct. You just call Pet Partners. They'll walk you through the plans. You can enroll directly with them. So the last couple of pages in your guide talk about your parental leave policy, but then also your 401k. Again, we don't help service your 401k, but my advice would be don't overload yourself with insurance products. Put your money in the 401k and save your money on that. Just if you need help kind of walking through what insurance products are right for me, I'm happy to help you do that. Or you can also make an appointment with us. All of our people that work for us are paid salary. They're not on commission. So they're not going to try to talk you into one policy versus the other. Any questions on anything in the benefit guide?
Are we staying with Empower?
Yes.
Any other questions?
Real quick before you guys go, you're gonna log in between now and next Wednesday. You'll start your enrollment right here. And then Emily has created a nice little chat box over here. So if you have a question, put your question in there and it should generate an answer for you. And if you get your answer to your question, great. If not, you still have questions, you have options. Emily and I will be here. Emily has office hours
Friday, Monday, and Wednesday.
here in the training room. And then obviously the renewal team, you have their contact information. So we're super excited about the new plan option. We think it's going to be really, really beneficial to a lot of employees. So yeah, let us know if you have any questions, but get enrolled for 2025. Thank you guys.